The general osteopathic treatment is an approach used by a number of osteopaths, which is examination treatment as you go. It's a way of focusing on all of the joints from head to toe, toe to head, examining and then treating, incorporating a lot of the techniques that we've already seen. Of course, with every patient, you still take a case history, you still do an examination, you still consider all of the red flags and differential diagnosis. Once you've gone through that, you can then apply this approach as necessary with individual patients. We would often start at the feet and the ankle, looking at the ankle joint, gently applying an anterior and posterior glide to the ankle, just to see if there is a particular problem. Going through into the medial border of the foot, along the medial border to the toes, and then through the individual metatarsals to the toes, just assessing whether the movement is there, the lateral border of the foot, and then the bottom joint of the foot under the talus, the subtalar joint. Just gently looking at the ankle, bending the knee up, gently feeling through the calf tissues. And if something were to be found that was not functioning correctly or there was too much tension, that can be immediately treated as you're going along. We can come in here and check knee flexion, flexion with a rotation of the tibia to see if there's any meniscal problem. Gently bring the knee into this position to check for medial gapping, and from here lateral gapping. Palpating the sides of the knee to check for the position of the tibia. Coming through, checking the ligaments of the knee, also the superior tibiofibular joint, and then knee extension and patella movement. Continuing more proximally, feeling the hip for all its different ranges of movement in all the different directions, and then through into the sacroiliac joint, and then to the other leg, the ankle, medial border of the foot, the metacarpals and the toes, the lateral border of the foot, cuboid, cuboid calcaneum, subtalar joint. Once again, looking at the soft tissues of the calf. And then the knee. Knee flexion with rotation, and then gapping, medial gapping, lateral gapping, shift of the tibia, internal ligaments, superior tibiofibular joint. We can also check the tension of the hamstrings, popliteus, and then the quadriceps. And then look at the sacroiliac joint, just taking the tension there. We can just check the top of the pelvis, the pubic symphysis, to see if it's lying symmetrically, a little bit of local pressure. And then we can go to the shoulder, just checking for range of movement, to see if there's any restriction, any dysfunction. Checking the elbow flexion extension, gapping the medial side, gapping the lateral side, and if there's a restriction felt, we can then work that joint to release it, work the radial head, and then just pronation, supination of the forearm, check out the joints and bones of the wrist, base of the thumb, and the metacarpals in the hand and the fingers. Repeating on the other side, just checking for movements through the shoulder. And then once again the elbow. Both gappings, medial and ulnar, lateral humeral ulnar, and then the radius, the forearm bones, and then the wrist, the hand and the thumb, and then if the patient lies on the right side, in this position it's quite easy to assess the sacroiliac joints, the lumbar spine, and start to work some of these tight muscles. Maybe mobilize the joint, and then if necessary, in this position, go straight into a manipulation. And where you feel the tension, release. Carrying on up through the thorax, working through the muscles, palpating the segments, just working through the muscles on the other side, asking the patient to lie onto their back. Having found one or two restricted segments in the thoracic spine, we can pop the patient into this position to release off the relevant segment and let the arms down. Finally coming up to the neck, just examining individual joints from side to side. Trying to mobilize and trying to finish the neck with just a simple technique to release the segment. And then mobilize with a little bit of stretching. And finally finishing with just some examination techniques of the cranial, sacral and visceral systems. You can bend your knees, please. Just lift your pelvis. Place the hand under the sacrum and just ask the patient to relax. And just try and relax and feel tension, movement into the sacrum. See if there is a direction that the tension is being drawn to or drawn into. Gently try and work with that to release that. Once you've released the sacrum, lift up. We can then now place the hand onto the abdomen and just listening to the abdomen to see where tension may be drawn, so that there may be a visceral association with the symptoms that may require a specific visceral technique to be directed to that. And then finally coming to the head, at the very top end, we can sit down and just, having got the table in the appropriate position, gently listen under the head, under the occiput, just relaxing, let the head tension relax, and just feeling the rhythm of the craniosacral system Once again, seeing where that tension may be pulled or drawn to within the head, within the neck, or within the rest of the spine and the body. And if necessary, specific craniosacral techniques can be applied. This system of general osteopathic treatment is not appropriate for everybody, but it certainly works in a large number of patients to allow the therapist to very smoothly and easily work through the whole body. And wherever there's a problem, you can stop, you can work on the soft tissues, you can mobilize the joints, you can manipulate, therefore releasing the problems as you go. Very often, as you've released one or two things, everything else is starting to loosen off as well. The treatment can be applied in a more quicker tempo in order to stimulate the system. The treatment can be applied in a much slower tempo in order to relax and reduce tension, depending on the individual patient's problem.